is the thing that's probably the most important for us.
Yes.
As, as providers, is kind of like the check. The thing that they reiterated several times that night. When you went through EMT school and when you practice, do they is the idea of the 5 rights a common thing?
It is 100%.
Okay. The 5 rights is the check that we use to make sure that whatever medication we are going to administer is correct. Is 100% we're mitigating as much risk as humanly possible in going through asking these 5 questions.
And number 1 is, do you have the right patient?
That
might be important.
Yeah, maybe.
It might just be important.
Well, so here's something. It sounds very obvious, especially if you only have one patient. But we're going to talk about some drugs and we're going to talk about the concept of EMT administered drugs versus EMT assisted drugs.
Yeah.
And one of the big aspects of assisted medications, it has to belong to that patient.
Uncle Joe's pills that were left over from the last time he went to the doctor that are in the medicine cabinet, but
it's not an uncommon thing to show up on a chest pain call and somebody has pulled out a bottle of nitro that belonged to grandpa and it's not theirs and they happen to start taking it, but it's not prescribed to them. And so you can't assist them with that, or maybe they've already taken it, which is sometimes even worse.
The one that I can imagine happening very likely is responding to somebody who has gotten a bad allergic reaction.
Yeah,
sure.
We can't in Pennsylvania, and I believe that nationally, we can't administer epinephrine or epinephrine auto injectors.
Right.
But we can assist a patient with their auto injector,
assuming.
But we cannot assist a patient with an auto injector if it's not their auto injector. Right? It has to be their prescription. We can't just be like, oh, I know what I'm doing. I know I can, epinephrine's for this. We're not doctors. We have to check ourselves with that. So it has to be the right patient. But also because it's very easy to accidentally use the wrong medicine accidentally on a patient. So you always have to check to make sure you have the right patient. So we need the right patient. Number 2, we need the right medication, which seems self-explanatory, but sometimes you need to make sure that little bottle of aspirin is actually aspirin or not.
You mean there might be a different thing in the bottle?
Well, it could be a different thing in the bottle, or you might just grab the wrong bottle. Aspirin, the little white tablets of aspirin look like little white tablets of morphine. You got to make sure you grab the right one.